Hello, welcome to JNP Project YouTube channel and podcast. I'm the host, Miki Miura. I'm a family nurse practitioner in Hawaii, USA. In this channel, we talk about everything from how an international nurse can become a nurse practitioner in the USA, how to build amazing career as a nurse practitioner, and also have a good work and life balance and enjoy our lives. Before we're gonna get into today's topic, which is working in a primary care as a nurse a waste or is it worth it? I just want to talk about very exciting news that we're gonna have a first group mentorship program this July. It's gonna be 6-month program. This is specifically for international nurses. Everything's gonna be English. So you're going to have a lot of opportunities to not only listen English, but also speak in English, present in English, and write in English. We're going to talk from how to how to learn medical English, also how to communicate with patients in English in the United States, American nursing, the relationship between the patient and the healthcare professionals, struggles and pains that a lot of international nurses would face in the United States. This is going to be very intense and hands-on program. It's going to be 6 months, and you're going to have a once a month live Zoom call with me and your classmates, and you also have an access to exclusive Facebook page that you can connect with your classmates in the future with graduates, and then also with me. And you also gonna have a lifetime access to online lessons. This is gonna be get updated, but you also have access to the updates. It comes with the workbook, so you have something that you can actually, go back to. So it's gonna be very, very helpful for international nurse to make their dreams of becoming a nurse practitioner in the United States come true. If you're interested, you can go to the website usa.jnpproject.com, usa.jnpproject.com. Okay, so today's topic is working in primary care as a nurse a waste? Let's dive in. So, today's topic is working in primary care as a nurse before entering a nurse practitioner program is a waste. So like I said before in the previous video, I mentioned that I would recommend at least a few years, 2 to 3 years of nursing experience, preferably in acute care setting before entering a nurse practitioner program. But what about the experience in primary care? Again, in the previous episode, I mentioned that I had 4 years of nursing experience before entering my nurse practitioner program, 2 years in acute care setting, which was at a university hospital in Japan, pediatric unit and pediatric ICU, and then 2 years of primary care as a nurse in the United States. I learned a lot from the experience in the primary care, and it was very helpful because I became a family nurse practitioner and work in a primary care. So that experience was directly helpful to what I do today. When I say primary care, you can think about outpatient setting, outside of the hospital. There are multiple things that were helpful, but one of them was the roles of different members. There are, people, receptionists, there are a staff like medical assistants or registered nurses, and then there are coding people. There are different people work together. So very helpful to understand different team members in the healthcare team, in the outpatient setting or primary care setting. Also, when I was working at acute care, I thought, well, acuity is higher, so I know everything because I was young. So I thought I know everything. I had experience at ICU, so I know everything. But, things are just different in primary care and acute care. So working in a primary care really helped me to understand how things are done in primary care setting. It's not really just the acuity, but also how things are done were so different. Also, when I was working at a primary care setting, or outpatient facility rather, I learned about the coding. I actually did some coding when I was working at outpatient setting as a nurse, and that was very helpful. So for those of you who don't know the term coding, so coding is to assign a code, like a number to different office visits. So let's say you saw a provider, nurse practitioner, physician's assistant, and the visit was 20 minutes, or, the whole visit was 30 minutes, or, the visit was just for simple case versus that was for multiple difficult cases with prescriptions, medications, or referral to other provider, or you order multiple tests, blood tests, x-ray. It depends on the length of visit and then also complexity of the visit. That determines how much the visit costs. And then put in the code, and then you submit the code to patient's insurance company, and the insurance company paid the, part of the money to the practice. So, this is also very complex thing about American healthcare in general, which we're gonna go over in the mentorship program. But healthcare in the United States is very complex. So working in the primary care helped me to understand how to code, also how this complex insurance system works. And coding is really important for nurse practitioners because some employer require nurse practitioners to assign coding for the visits that they had with their patients. Like my main job is at community health center, and I have to code on my own. Plus, my productivity bonus is based on the code. So coding is extremely important. Also, if you end up having, if you're planning to have your own practice, you definitely need to learn how to code, because if you don't code, you don't get money and you cannot sustain your business. So coding is very important, and you don't learn that in nursing school. Most likely you don't learn in the nurse practitioner program in depth. So working in a primary care setting really helped me with that too. Especially also helped me to understand this complex healthcare system in the United States, different insurance, Medicaid, Medicare, all those very complex topic. So that was helpful. So I would say definitely not a waste to have experience in a primary care setting as a nurse. Ideally, like I did, you want to have both experience if possible. I hope this video was helpful. Let me know if you have any requests for the topics. This episode is a little bit short, but I'll see you in the next episode. Take care. Aloha.